So this video is for basic facial, and we're going to start the video as if we've just arrived to work. So of course, when we arrive at work, we're going to wash our hands first thing, go to the sink, get some water, wet the hands, coin size of liquid hand soap. We rub those hands together down to the wrist, and we wash the back of our hands to the wrist. We wash the fingers. We wash the backs of the fingers, between the fingers and the thumbs. We wash fingertips and nails. We wash thumbs. We wash wrists. All of that for a minimum of 20 to 30 seconds before we get to the sink, where we really do a thorough, proper rinse at the sink. Once we're properly rinsed, we'll grab some disposable paper towels and turn the faucet off. Dry the hands with the towels and then toss the towels into the trash. Then we grab our 70% ethyl alcohol hand sanitizer, and we finish by sanitizing our hands. So our hands are clean, and we look at our appointments for the day, and we have a facial is our first appointment. So we're going to get our room ready for that, and we have to go over what you need to do to prepare your workspace and station and room. So you're going to disinfect your workstation, bed, and equipment using a disinfectant wipe following the manufacturer's instructions. You will check your equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You'll gather clean supplies needed for the facial service, storing in a clean closed container. You'll turn on the hot cabbie and stock it with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. You're going to fill clean steamer glass with distilled water and preheat that steamer. You're going to dispense products needed for the service according to the skin type and client's needs as follows. You'll prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or you can remove the product with a disinfected or clean single-use spatula. You can close the lid to the product and set the portion cup tray on the tray. You will drape your facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place the clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and a headband on the top of the first towel, along with a rolled towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. And I just realized that I need 1 more towel for myself, for my hands. I'm going to grab that. And then when you have done that, it is time to do your client consultation. So let's just review what is on our tray for our basic facial that we have set up here. So we need, I have my bowl of water. We need makeup remover. We have cotton rounds. We have 4x4s, gloves, wooden stick Q-tips, some gauze, makeup remover, toner, cleanser, exfoliator, massage product, mask, eye cream, and moisturizer. And I'm just going to get another single-use spatula that I'm going to be breaking off and, using to scoop out my stuff. So, my tray set up. I'm going to greet my client for the client consultation, and of course, I'm going to be doing that with clean hands. So, when I meet with my client, I'm going to greet my client and escort them to the work area. I will determine the client's preferences and assess the client's needs. I'm going to assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. I'll assess client's consultation form for any medications and products used within the last 72 hours. I will consult on any known allergies. I will consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care, I will assess if the client is prone to cold sores or fever blisters. I will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. I will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from all of those contraindications, we can move forward with the procedure. And my client is. So what we need to do now is get the client comfortable, and then we're going to wash our hands before we start the actual facial. So we're going to give her privacy because she would disrobe for this service, doing her, putting on her wrap. And so once she's done that, you can go in and get her tucked into the bed. I have a rolled towel here that she can place under the neck. I'll place it there for more comfort for her. I am going to place a headband on to keep her hair out of her face for the facial. And then I have a third towel that I'm going to place over her décolleté, protecting all of that. So she's cozy. And before we start the service, we need to wash our hands again. So that's what we're going to do first, is we are going to wet our hands, and we're going to get that coin size of liquid hand soap. We're going to wash our hands down to our wrists. We're going to wash the back of our hands down to our wrists. We are going to wash our fingers. We are going to wash the backs of our fingers. We are going to wash between our fingers, and we are going to wash between our fingers and our thumbs. We are going to wash our fingertips down to the nails, of course, the nails. We're going to wash our thumbs. We're going to wash our wrists. All of that interlocking for a minimum of 20 to 30 seconds. And then you're going to rinse your hands thoroughly underneath the water. Once you have properly rinsed, you will grab some disposable paper towels, turn off the water with the hand with the towels. Then you can dry off your hands completely, toss the paper towels, and then grab your 70% ethyl alcohol hand sanitizer, and then you will sanitize your hands. And once your hands are nice and sanitized, you are ready to perform your service. So the first thing that we're going to do is remove eye makeup and lipstick. So we're going to get our makeup remover and our cotton rounds, and we're going to place those on our eyes. And this may take a minute if your girl's a little bit more glamorous, and that's okay. And eye makeup. just going to dry her off real quick. And we're going to do our first cleanse so that we can then do a skin analysis. And then we will remove that cleanser. And once you have done that, you are going to find some cotton rounds, because we're going to do our skin analysis, and it's you're going to be using a magnifying lamp or a Woods lamp. It's bright, so you're going to cover up the eyes. And we're going to bring our mag lamp over, a magnifying lamp, and we're going to turn it on so it's super bright. And then you're going to get in there and do your proper skin analysis. So what I'm doing now is I'm looking for some things that we discussed. I'm also looking for things that I see. So I may be looking for dehydrated skin, maybe looking for excess sebum. She was a little concerned with fine lines, looking for that. I'm going to look for some hyperpigmentation. Just basically really taking a minute here to do a proper skin analysis so that I can not only figure out some good things for us to do in service today, but recommendations for products for her to support her at home. Also, recommendations for our net plan for our next time. next facial, next service, or recommendations that I can make for her. So always thinking ahead, but obviously looking at the skin and analyzing today for where I need to do the best things that I can do to make her feel and look her best when she leaves today. So I don't rush through this process. I'm really going to take a minute to look at everything and see and feel and touch everything. And then once that's done, you turn off the light and you would place it out of the way. So I'm going to take off the iPads now because we did that and the light's off. And then now I have to do my second and third cleanse. So I'm going in now for my second cleanse. And I'm going to take off that second cleanse. Now it's third cleanse. and we are going to wipe off third cleanse. Okay. Once your cleanses are done, it's time for your toner. And I'm using a spray on cotton rounds. And just what you have to know is that you don't let your spray toner touch the cotton round. That's the most important thing. That you're going to spray, but you're not going to let anything touch. So now we've done the toner, and after this step is going to be exfoliation. So what we're going to do, of course, we would follow our manufacturer's instructions, but we're going to get like a pea size of our exfoliant and then place it on our client, and then we're going to massage it in anywhere from 1 to 2 minutes. course, we're always going to avoid the eyes, nose, and mouth. And this is good. So we've done our massage now for our 1 to 2 minutes. And I'm going to read through the next part because I don't have the equipment for that. So let's just talk about it. So after you do that, massage, etc., we will retrieve the steamer and we'll turn it to the on position. We will position the steamer next to the facial bed, facing it away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, we can position the steamer 16 inches over the client's face and aim it at the client's chin for even distribution on the face and allow the unit to function for 3 to 5 minutes. And then you'll remove the steamer from the client's face, return the steamer to its previous location for disinfection. So you're going to bring that steamer over, it's facing away, let it heat up, and when it's ready to go, you'll turn it and position it so that it's facing the client towards the chin, and that way it'll just do that up and even flow. Because we don't have the equipment and also because we're doing a video, we are going to just move forward and pretend like that steamer has been on for 3 to 5 minutes, and then now we're taking it away from the client and we're putting it back to where we got it from, turning it off, so for disinfection for later. So what we're going to do now is pretend like I have a hot cabbie, which I do not, so we're going to get a towel out of my hot towel out of my hot cabbie, and what I would do, obviously, is test the temperature on my wrist because it could be super duper hot. And then I'm going to test the temperature on my client's collarbone, and she says it feels great. So I'll get my nice steamy towel ready, and I'm going to place it on top of the client's face, but I'm going to leave the nose out. And this is how we're going to remove the exfoliant. And then you would just place it out of the way. And after your exfoliant is done, this is where you're going to place your gloves on because you're going to move into extractions. Now the skin is nice and soft. So you need to put on your disposable gloves. And you have a couple of options. You can use those wooden sticked Q-tips with astringent, soaked in astringent, or you can use cotton rounds soaked in astringent. If you use those wooden sticked Q-tips, you need to get 2 more for every extraction that you do. That's what I'm going to do versus cotton rounds. If it's cotton rounds, you can just use your set of cotton rounds and work your way around here as you do your extractions. So I'm going to take my astringent and wooden stick Q-tips, and I'm going to soak them before I go in and do my extractions. And I'm getting another set soaked in astringent. So every time, another set. When you're doing extractions too, you don't want to do this part of the facial more than 5 to 7 minutes because it can be painful and uncomfortable for the client. We've got one more to do. And after this, you would follow up with toner. So we're going to go ahead and remove our gloves and toss them, because anytime you use your extractions and etc., you're going to toss your gloves. Of course, they're disposable. You're going to wear them and you're going to toss them, and then you're going to go back and tone. Once again, I'm spraying my toner and I'm not letting it touch the pad. And the good news is that after the no fun of the extraction section, she gets to the massage section. So the next portion of her facial is the massage, and so that at least is calming and soothing and relaxing, and she's going to be really happy about it. Massage portion is make sure when you get to the massage portion, excuse me, that you take out enough massage product before you start your massage, so that you're not having to go back in and out of your portion of your massage product, so that when you get it out, you scoop out enough for the entire massage, so you feel like you're good to go on your massage. So I will spread out what I'm going to use for my massage first on the client, the product, and before I start my massage. That way I'm not going to be re-dipping into anything or leaving, my hands won't leave her until the massage is finished, so she can truly get that relaxing experience. Just spreading it around before I start, and then I'm able to start and fully complete my massage without stopping or leaving her. So I won't be talking for this portion. It's just going to be me doing all my different massages that I'm supposed to do on the face, showing the different methods of massage. . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . And once you have finished that massage, you are going to remove the massage product. She looks amazing, but we're not done yet. All right, so the next thing that you're gonna do after you finish your massage is you're gonna apply a facial mask to her. Of course, just like the exfoliating step and everything else, we're gonna avoid the eyes, nose, and mouth. So we have our brush, and we're gonna apply our mask with this brush. We're going to apply it to the neck and the face. In beautiful long strokes. And of course, you're going to follow manufacturer's directions, but we're going to talk about this for just a second. So, once you have evenly applied your mask, looks good. You will, based on the mask and the client, you're going to allow the mask to sit on the face for 5 to 10 minutes. We are videoing, so we're not going to set a timer and do that, but just so you know, you need to check that before you apply your mask, like how long it's going to be sitting there, etc. So we know that this time has elapsed theoretically And what you're going to do now is remove the mask. Now I'm using also 4 squares throughout this, except the exfoliation process. I use that hot towel because I don't really have a hot caddy. But I personally would prefer to use towels for every remove, just so you know you can do that, and I would recommend that. But it's up to you. But I sure love a hot towel. I don't want cold water not a very relaxing, comforting facial to have cold water being put on me all the time. So when I'm trying to rest, a nice steam towel would be beautiful to remove. I don't have that caddy, so I'm just using these 4 squares. But just so you know, that would be my normal thing that I'm doing, would be a towel for every remove. Which means I would be checking the temperature of those towels every single remove. And I'm making sure, of course, not to get anything in the eyes, in the nose, or the mouth as I'm doing this step. Goodness. Sorry, y'all, my neck hurts. And we have got our mask removed. So we're going to go in with toner. Final tone. Once again, I'm going to spritz my cotton round. And I'm not going to touch my spritzer to my cotton round. Keeping that distance. And she is nice and toned and gorgeous. So what we're going to do now is finishing up here. She needs her skincare applied. So we're going to apply a little bit of eye cream and a little bit of a moisturizer. I'm going to use one with an SPF because it's daytime. So you take a teeny little bit of that eye cream on your ring fingers, and you're going to place it on the brow bone and the zygomatic arch, and light tapping motions to get it there. We are also going to next then apply her day cream, because it's daytime, with the SPF, and I'm going to apply it everywhere. We always talk about the importance of the sunscreen. We would have done that in the consultation as well, but I would apply it to her décolleté. I would apply it to the neck. My client's a little on the drier side, so this is a hydrating moisturizer with sunscreen anywhere that she might need that, and if her hair's back or ears. And we'll discuss that again, but we'll finish up making sure she's like super glowy, hydrated, gorgeous, which she looks and feels amazing after the facial. So we got her eye cream and her SPF daytime moisturizer. If it was nighttime, I could have gotten her ready for her bedtime makeup. And then let's talk about what happens. So we're going to give her some privacy, and let's finish our facial. So I say okay to my client to let her know that we are finished, and I'll step away, let her, because she's going to get dressed, etc. And then I'll be waiting for her to discuss our follow-up, like what her maintenance and aftercare is going to be. I'll send her home with her aftercare kit. We will discuss maybe products potentially that she would need going forward at home to maintain, and then what our next booking should look like, our next appointment, how long it should be, and then what our next treatment option should be. And then we'll get her checked out, and then you've got a full day ahead. So you've got to get back to that room and get it ready for the next client. So you're going to take all those single-use items like your little disposable cups, etc., and toss them. You will get all of that laundry, the sheets, the bedding, the towels, the headband, etc. It's also going to be put in a closed container until it's time for laundry, and you're going to get all your implements, and you're going to place them in a closed container that's clearly labeled to be disinfected. Then you have to clean your workstation. So you're going to identify proper cleaning agent, read the manufacturer's directions, and follow the manufacturer's directions for mixing and usage. You'll wipe down your workstation and area with the cleaning solution to remove any debris. You'll then identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting, which means you're putting your gloves back on. And then, or a new pair of gloves on, obviously. Follow manufacturer's directions for mixing or using appropriate aerosol disinfectant. You'll disinfect electrical equipment and store it in a clean area separate from other implements like your steamer that you used, your mag lamp. And then to complete, you have to wash your hands. So take off those gloves, toss them into the trash. And then you're going to wet your hands, and you're going to identify that liquid hand soap. Wash your hands down to your wrists. And then the back of the hands down to the wrist, you are going to wash your fingers and the backs of your fingers. Make sure you wash your fingertips and your nails between your fingers and your thumbs. You'll wash your thumbs and your wrists, all of that for a minimum of 20 to 30 seconds. And then you're going to take a proper rinse under the sink. When you feel like it's all rinsed off, grab those disposable paper towels, turn the faucet off, and then you can thoroughly dry your hands off with the towels. Throw those paper towels away, and then grab your hand sanitizer that is 70% ethyl alcohol, and you are going to then do your hands. So then you are now ready to start setting up for your next client, who will be here in, let's say, 15 minutes. So get on it, doggone it. And that concludes your basic facial video.